Bismillahirrahmanirrahim. I'm going to do discussion on the topic of multiple myeloma. Hope so it will prove beneficial for you. Now first we discuss that what is the multiple myeloma. It is actually the plasma cell neoplasm. The plasma cell neoplasm, there is not a normal plasma cell but a malignant plasma cell which abnormally synthesize the excessive amount of immunoglobulins or the fragments of immunoglobulins which accumulate inside the cells as well as released in the serum, and these immunoglobulins, they have the pathologic effect on the body in different forms. Like in the multiple myeloma, it causes the lytic bone lesions, and when the bone is rapidly being resorbed, then there would be resultantly hypercalcemia would also occur, and there would be renal insufficiency due to various tumor markers and the various immunoglobulins which also act as tumor markers. Due to the effect of those immunoglobulins, there would be a renal insufficiency as well. And the fourth, there would be the acquired immune abnormalities due to the decreased production of normal immunoglobulins. Acquired immune abnormalities. So multiple myeloma, it is a plasma cell neoplasm which is associated with lytic bone lesion, hypercalcemia, renal insufficiency and acquired immune abnormalities, and these all are due to the effects of excessive production of abnormal immunoglobulins. Now we discuss about the morphology of plasma cell multiple myeloma. Morphology. As we discussed previously, that it is the destructive plasma cell tumor, and it mainly involves the axial skeleton of our body, and in decreasing frequency. I will list out the bones which are most commonly affected. The most commonly affected bones are the vertebral column. Then on the second number there are the ribs, then skull, then pelvis, and so on. These are the bones which are most commonly affected. The most commonly is the vertebral column, then ribs, then skull, then pelvis, and so on. These lesions, they actually begin in the medullary cavity. They first begin in the medullary cavity, and then they continue to erode this cancellous bone and reach up to the cortex. So they weaken the bone, and as a result the pathologic fractures are most common in the patients of multiple myeloma. And radiographically on X-rays or CT scan on bones, you will see the punched out defects. On X-rays or on various CT scan or MR, other radiographic modalities, you will see these punched out defects which are the characteristic for the multiple myeloma. When there is a widespread multiple myeloma, then instead of these focal defects, that these point out defects, there would be the diffuse demineralization, and which is known as osteopenia would occur, and overall the strength of bone would weaken. Now next we discuss about in the bone marrow, what you will see. There would be an increased cellularity of plasma cell. The number of plasma cell, it would be more than normal, almost more than 30%. These are the plasma cells, and here I draw a plasma cell which is the characteristic of the multiple myeloma. What is that? You will see that the nucleus would be in eccentric location. Like other normal plasma cells, the nucleus would be in eccentric location, and there would be a perinuclear clearing, that around the nucleus there would be a clear area, and this is due to the prominent Golgi apparatus. And in the bone marrow, plasma blasts are present, these are they look like normal plasma cell, and other are bizarre multinucleated cells are also present. Okay. um, Plasmablasts and bizarre multinucleated cells are present, and other cytologic variants would also be noticed in the bone marrow examination. What are those other cytologic variants? The first is the flame cells. Why it is called flame cell? Because in the cytoplasm you will see the cytoplasm is very red cytoplasm. That's why it is called the flame cell. The second variety is the mott cell, and mott cell is due to the accumulation of excessively synthesized immunoglobulins in the vacuoles. So there would be many empty spaces in the cell, like an eaten up by an insect. That's why it is called the mott cell. And other cells containing various inclusions, various globules, like fibrils, crystalline rods, and globules. There are two types of globules. One is the Russell bodies and the second is the Dutcher bodies. One is Russell bodies and second is Dutcher bodies. The globules, if they are cytoplasmic, these globules, if they are present in the cytoplasm, then they would be called as Russell bodies, and if they are present in the nucleus, then they would be called Dutcher bodies if they are nuclear. Next is the important characteristic present in the multiple myeloma is the Daleks formation. That if the peripheral smear is formed, the Daleks will form. In multiple myeloma, there is an increased production of the M protein. It is actually the immunoglobulin, and due to this increased M protein, the cells they get stick to each other in a linear array, and a Daleks is formed. This Daleks, it is a characteristic of multiple myeloma, but not specific, because it is also present in other conditions like systemic lupus erythematosus as well. Then there's another term, that is myeloma kidney. Myeloma kidney is a diseased kidney due to the various proteins which are excreted via kidney in the multiple myeloma, which damage the renal tubular cells, the renal tubular epithelial cells, and so the kidney is damaged, and that kidney is known as myeloma kidney. Now we discuss about the clinical features of multiple myeloma, that how the patients of multiple myeloma they are going to present to us. Clinical features, and these clinical features they are actually due to the excessive amount of immunoglobulins which are being synthesized and which have the pathologic effects on our body. The first is the pathologic fractures. The first is the pathologic fractures, and it occurs due to the excessive bone resorption, and the second is the chronic bone pain. It is also due to the infiltration of bone with these malignant plasma cells. Then there's hypercalcemia. Hypercalcemia is as a consequence of the excessive bone resorption, and due to the hypercalcemia, the patient will present with the neurological manifestation that he would be having headache, vomiting, or maybe he is having the constipation or polyuria. The fourth is the recurrent bacterial infections. These patients are prone to have the recurrent bacterial infections, and it is due to the decreased production of normal immunoglobulins. The fifth is the renal insufficiency. Renal insufficiency occur because there are in multiple myeloma the light chains are excreted in the urine, and these light chains they are toxic for the renal tubular epithelial cells, and certain light chains they cause the amyloidosis, so there would be the damage to the kidney. Now next comes there are so what is the clinical features? There would be either pathologic fractures, chronic bone pain, or there would be hypercalcemia and its secondary effects, and then would be the recurrent bacterial infections and renal insufficiency. Now we discuss about the diagnosis of multiple myeloma, that how we are going to diagnose a patient of multiple myeloma. The first we discuss the labs. In laboratory findings in the blood, there would be an increased level of immunoglobulins. Increased level of immunoglobulins may be more than 3 gram per deciliter, and mostly in 55% of the patients there is the immunoglobulin is IgM variety. No, IgM not, IgG variety. IgG variety, while in 25% of the patients, these patients have in their blood the raised level of IgA, while IgM, IgD, and IgE, very few patients have the increased level of these immunoglobulins. While in urine, you will find in urine the light chains are present. The light chains are excreted in urine. So we will on urine electrophoresis, the light chains are recovered, and these light chains they are known as Bence-Jones proteins. What are these called? They are called as Bence-Jones proteins. These are the fragments of the immunoglobulins. That's why they are filtered out of the glomerulus, because the light heavy immunoglobulins they cannot be filtered out, while because light chains they can be filtered out because they are the fragments of immunoglobulins. And then on the first is the labs, and second radiographic examination, there would be characteristic punched out defects would be present, and the third is the bone marrow examination. You will see the plasma cells which we discussed in morphology, the characteristic type of plasma cells, and the definitive diagnosis depends on the bone marrow examination. So I will repeat the diagnosis, that in labs, in blood, there would be an increased level of immunoglobulins more than 3 gram per deciliter, and 55% of the patients they have the IgG variety of immunoglobulin. It is also known as M protein because it is present in multiple myeloma and for multiple myeloma. And 25% patients have IgA level. And in the urine, there would be the light chains would be present. They are called Bence-Jones protein. And second, the radiographic examination, you will see the characteristic point out defects. And third, the bone marrow examination, the characteristic plasma cells would be present. That's all about the multiple myeloma. Thanks for listening.